Okay, the Real Gonadotrophins. Sorry. From Pounds and Inches by Dr. Simeons. Must read. Two hormones known in the female as follicle-stimulating hormone, FSH, and corpus luteum-stimulating hormone, LSH, are secreted by the anterior lobe of the pituitary gland. These hormones are real G's. I'm just going to call them G's because I can't say that word. Are real G's because they directly govern the function of the ovaries. The anterior pituitary is in turn governed by the diencephalon, and so when there is an ovarian deficiency, the diencephalic center concerned is hard put to correct matters by increasing the secretion from the anterior pituitary of FSH or LSH, as the case may be. When sexual deficiency is clinically present, this is a sign that the diencephalic center concerned is unable, in spite of maximal exertion, to cope with the demand for anterior pituitary stimulation. When then the administration of HCG increases the functional capacity of the diencephalon, all demands can be fully satisfied and the sex deficiency is corrected. That this is the true mechanism underlying the presumed G action of HCG is confirmed by the fact that when the pituitary gland of infantile rats is removed before they are given HCG, the latter has no effect on their sex glands. HCG cannot therefore have a direct sex gland stimulating action like that of the anterior pituitary Gs, as FSH and LSH are justly called. The latter are entirely different substances from that which can be extracted from pregnancy urine and which, unfortunately, is called chorionic G. It would be no more clumsy and certainly far more appropriate if HCG were henceforth called chorionic diencephalotrophin. Jeez. HCG No Sex Hormone. It cannot be sufficiently emphasized that HCG is not sex hormone, that its action is identical in men, women, children, and in those cases in which the sex glands no longer function owing to old age or their surgical removal. The only sexual change it can bring about after puberty is an improvement of a pre-existing deficiency. So for all you women out there, maybe it'll correct the unhornies. Let's see. But never stimulation beyond the normal. In an indirect way via the anterior pituitary, HCG regulates menstruation and facilitates conception, but it never virilizes a woman or feminizes a man. It neither makes men grow breasts nor does it interfere with their virility, though where this was deficient, it may improve it. It never makes women grow a beard or develop a gruff voice. I have stressed this point only for the sake of my lay readers, because it is our daily experience that when patients hear the word hormone, they immediately jump to the conclusion that this must have something to do with the sex sphere. They are not accustomed, as we are, to think thyroid, insulin, cortisone, adrenaline, etc. as hormones. Importance and potency of HCG. Owing to the fact that HCG has no direct action on any endocrine gland, its enormous importance in pregnancy has been overlooked and its potency underestimated. Though a pregnant woman can produce as much as 1 million units per day, we find that the injection of only 125 units per day is ample to reduce weight at the rate of roughly 1 pound per day, even in a colossus weighing 400 pounds, when associated with a 500-calorie diet. It is no exaggeration to say that the flooding of the female body with HCG is by far the most spectacular hormonal event in pregnancy. It has an enormous protective importance for mother and child, and I even go so far as to say that no woman, and certainly not an obese one, could carry her pregnancy to term without it. If I can be forgiven for comparing my fellow endocrinologists with wicked godmothers, HCG has certainly been their Cinderella, and I can only romantically hope that its extraordinary effect on abnormal fat will prove to be its fairy godmother. HCG has been known for over half a century. It is the substance which Ashkeem and Zondek so brilliantly used to diagnose early pregnancy out of the urine. Apart from that, the only thing it did in the experimental laboratory was to produce precocious rats, and that was not particularly stimulating to further research at a time when much more thrilling endocrinological discoveries were pouring in from all sides, sweeping HCG into the stiller backwaters. That's kind of funny. Complicating disorders. Some complicating disorders are often associated with obesity, and these we must briefly discuss. The most important associated disorders and the ones in which obesity seems to play a precipitating or at least an aggravating role are the following: the stable type of diabetes, gout, rheumatism and arthritis, high blood pressure and hardening of the arteries, coronary disease, and cerebral hemorrhage. Whoops, I went a little too far. Apart from the fact that they are often, though not necessarily, associated with obesity, these disorders have two things in common. In all of them, modern research is becoming more and more inclined to believe that diencephalic regulations play a dominant role in their causation. That damn phone. The other common factor is that... Bear with me. The other common factor is that they either improve or do not occur during pregnancy. In the latter respect, they are joined by many other disorders not necessarily associated with obesity. Such disorders are, for instance, colitis, duodenal or gastric ulcers, certain allergies, psoriasis, loss of hair, brittle fingernails, migraine, etc. If HCG plus diet does in the obese bring about those diencephalic changes which are characteristic of pregnancy, one would expect to see an improvement in all these conditions comparable to that seen in real pregnancy. The administration of HCG does in fact do this in a remarkable way. Okay, I'm going to stop for now. I got to answer my phone. Okay, the next subject will be diabetes. Stay tuned. Bye.